Monday to everybody. 27th day of September, the 270th day of 2021. Where has this year gone? And already you have to start thinking about some things that come up each and every year. And you guys know what happens around here about this time every week. We talk with our friends from Merkle Retirement Planning, and AnnaMarie Morrow is going to be joining us right now, Director of Medicare, because AnnaMarie, it is getting close to being that time of year, isn't it? First of all, hi, good morning to you.
Good morning, Lou. So great to see you. Thank you for having me today. And that's right. It's right around the corner. Annual enrollment. The smell of fall is in the air and football's on TV. So that can only mean one thing.
Annual enrollment should be coming up. There's a lot of people out there that are watching right now go, what do you mean? I just got done doing this. What do you mean it's already coming up? Explain what this is all involving.
That's so true. So you want to think about this time of year if you're on Medicare, just like you do every year, meeting with your tax accountant at the beginning of the year. October 15th to December 7th, if you're on Medicare, mark your calendars. This is the time of year where all new information for the following year is available, and you can make the changes necessary to make sure that you're still on the plan that best suits your needs for the following year.
All right, AnnaMarie, there's a lot of people out there. Again, I can hear them through the TV set right now saying, I already have it set up. I like what I have. Why is it so important to revisit this whole plan option, all the plan options?
Yeah, even if you love the plan that you're on, and let's say your prescription medications haven't changed, your needs haven't changed medically, these plans, drug cards, advantage plans, they can and they do change every year. At the beginning of this year, in March, I met with this couple for the first time. They came in to see me and they were visibly upset because their refills last year on their prescription medications were fairly low costing, $34 per refill. And then when they went to get their 90-day refill in February, it was hundreds of dollars. They didn't realize that their drug card had changed their medications to a different tier. So you just want to this is the time to do that prep work to make sure that your scenario, your situation still has you set up for success in the year to come.
Well, that's just one example of why it's so important to review everything. But beside the cost of drugs, what else could be adjusted on these plans from year to year?
So you can also, if you, let's say you don't want to be on an Advantage plan and you want to switch to more of the traditional supplement route, those lettered plans like Plan F or Plan G, this is the time frame to do it. You can also switch to an Advantage plan from a supplement. This is really where you have your freedom to not stay locked into whatever decision you made the previous year. So that's why it's so great to have one-on-one conversations with your agent to make sure that your needs are being met and that your doctors and specialists are still contracting with your plan for the next year. There's a lot to think about. And when you make that an individual one-on-one conversation with a planner, it can really remove that stress and provide you some comfort, especially when you're in retirement.
Now, AnnaMarie, over the years, you've seen these plans change year to year. The government tweaks them. Are the prescription drugs usually the things that get altered the most?
That is probably what we see the most changes in every year. Every drug card is different. Even if one insurance carrier has multiple drug cards, they all cover different medications and they are changing their tiered program every year. And basically what that means is there's 5 tier levels and each tier level costs something different. And so that's why you really want to make sure you do your due diligence, have your planner do their due diligence, making sure that you are set up in the perfect scenario moving forward to the next year, because that is what we see changes in the most on a year-to-year basis.
Now, is the annual enrollment just for people that are on Medicare?
It is. I mean, if you're on an employer plan, of course, you want to look at the benefits for the next year. But the big question I get before people have enrolled in Medicare is, I'm hearing this about Medicare annual enrollment. Do I need to do anything? Well, you haven't elected Medicare yet, so still look at the current plan you're on, whether that's employer benefits or on the individual marketplace, just to make sure that you're set up with what makes you comfortable for the next year. But typically when you hear annual enrollment period, it is for people who've already elected Medicare.
All right, good to know. Now, thankfully, you have workshops all the time. You have one coming up that's going to talk about this on Thursday. Now, tell everybody about this because it's over here in West Des Moines.
Yeah, we're putting on a Medicare workshop this Thursday at 6:30 at Simpson in West Des Moines. And this is great. We not only talk about annual enrollment and things to consider, but we also do a deep dive into what is Medicare? What are all these enrollment periods? What information is out there that can help me streamline these decisions? So we really do a great deep dive, and you can register for this workshop on our website at merkleplan.com or give our office a phone call.
All right, great idea. And yes, it is that time of year when the leaves are falling, there's football on TV. You know it's time to start thinking about your Medicare annual enrollment. AnnaMarie Morrow, thank you so much from Merkle Retirement Planning, and we will talk to you next time.
Thank you, Lou. You have a great day.
You have an awesome day as well.